This audio CD presents the techniques and protocols of the medical massage therapy system called the Homeosomatic System of Medical Massage Therapy, created by Dr. Gregory T. Lawton. The following material is an introduction to the basic fundamentals of medical massage therapy and is designed for the beginning student of medical massage. The Homeosomatic Medical Massage System of Therapy described on this CD was developed over the last 30 years and is taught at the Blue Heron Academy of Healing Arts and Sciences in Grand Rapids, Michigan. Hello, my name is Sandra Bovey, and I'll be your host during this 4-part presentation. I will guide you toward a better understanding of the healthcare science of medical massage therapy. Part 1 of this 4-part audio CD presentation will be an introduction to massage. In Part 2, we will talk about how to become a medical massage therapist and describe what medical massage therapy is. In Part 3, we will look at what the research says about massage and how research can positively affect how you practice massage and treat your patients. And finally, in Part 4, we will carefully review some of the science behind medical massage. The information presented to you in this audio CD program contains ideas and terminology that may be new to you as a beginning student of medical massage therapy. We suggest that you take your time and listen to each section and then take a break from the material. You will probably find that you need to listen to each section more than once, and it would be helpful to take notes while you listen. Let's talk about medical massage. Most schools of massage therapy either teach Swedish massage, variations on Swedish massage technique, or specialized systems of massage such as shiatsu. Swedish massage is also commonly called therapeutic massage. But not all therapeutic massage is Swedish massage. Confused yet? Most of the Western systems of conventional massage therapy, especially technique taught in the United States, are based on the work of Per Henrik Ling, who formulated the general and relaxation techniques of Swedish massage. In 1892, Emil Klein, MD, PhD, wrote in his book, Handbook of Massage regarding Ling and Swedish massage, quote, "But on the other hand, Ling's activity suffered from certain unfortunate defects. He lacked scientific training and was ignorant of medicine," unquote. Massage is generally thought to be therapy that is applied by the hand. Due to the popularity of the Ling system of Swedish or therapeutic massage, many of the higher-level skills of medical massage therapy were lost. That is, until now. Although almost all ancient cultures practiced some form of what we now call massage, there were really no standard definitions of massage. Hippocrates, who is widely regarded as the father of modern medicine, was an enthusiastic advocate of massage therapy and wrote, "Rubbing has the effect of relaxing, constricting, thickening, and thinning. Hard rubbing constricts, soft relaxes, much rubbing thins, and moderate thickens." He obviously had quite an opinion about massage therapy. The ancient Greeks used techniques called to rub up and to cause friction. No one seems to know precisely where the word massage came from. It is thought that the origins of the word massage may be from the Arabic verb mas, meaning to touch. But then again, there is a Greek word, masin, which means to knead. So basically, you can take your pick. We do know that much of the early massage practiced by various cultures around the world was practiced for medical purposes. Massage has probably existed ever since the first man or woman cracked their shin against a rock and rubbed it to make it feel better. It doesn't take a neurosurgeon to figure that out. The next step from there was probably to have someone else rub the boo-boo for you, and presto, the first massage therapist graduated. Before long, everyone caught on. In Africa, massage was called the way of the people. In Mexico, the massage therapist was called sobadora, and in Hawaii, massage is lomi lomi. All around the world and in every culture, since the beginning of time, there has been a massage therapist busily rubbing away. During the last half of the 19th century, the medical profession discovered massage and its language, applications, and education began to change. It was in the 1800s that massage therapy had a resurgence and was practiced by a wide variety of physicians and therapists. This was a time of experimentation, discovery, and renewal. Osteopathy was born, and so was chiropractic. Naprapathy came along in 1906 as the last of the great arts of manipulation born in the United States. Nurses routinely studied and practiced massage in hospitals, and the great medical spas and health centers operated successfully. But then along came the antibiotics and the miracle drugs, and that was the end of that. Until now. While massage therapy as a profession is just now developing the kind of scientific studies called for by medicine, massage therapy technique and treatment enjoys a very long history, over 11,000 years worldwide, which allows for another kind of scientific evidence, based on the collective observations of thousands of massage therapy practitioners from many global cultures. Clinical observation has long been a tool of science. Indeed, it resulted in Edison's invention of the light bulb. In addition, when studies of massage therapy have been performed, the studies have usually been performed using the general and superficial techniques of Swedish massage. For example, a study might indicate that patients with back pain received a back massage. Most massage therapy professionals employ several different techniques and exercises in a typical patient treatment session, making it difficult to measure the effects of a single technique. Future studies need to identify the specific techniques of different massage systems and then study the exact effects of those techniques. Medical massage therapy, by the adoption of the qualifying word medical, should be able to demonstrate clinical results. This idea is as yet unproven by research. While limited studies do exist regarding the generalized effects of Swedish massage, there are almost no studies on medical massage. The medical massage therapist must borrow upon research that has been performed in other disciplines, such as orthopedic medicine, physical therapy, chiropractic, and acupuncture. Massage therapy is experiencing a slow and gradual movement within the profession toward higher levels of academic standards, longer periods of study, entry into the profession by allied medical personnel, and acceptance into colleges, hospitals, and medical clinics. The highly generalized format and techniques of Swedish massage and relaxation massage therapy do not meet the clinical needs of a medical environment. What is needed is medical massage. Medical massage therapy is emerging as a system of treatment that does address the needs of a medical environment. Medical massage therapy achieves this because 1. Medical massage is not a general massage treatment. Rather, medical massage is applied as manual therapy to the specific area of the patient's problem. 2. Medical massage is delivered to a body part after assessment. 3. Medical massage protocol involves several steps or stages of treatment which attempt to correct abnormal conditions affecting a joint or muscle. 4. Medical massage therapy is not limited to myofascial tissues, but includes highly specialized joint capsule and ligament therapy. And 5. Medical massage adopts the medical techniques and protocols of other systems of health care. Swedish or therapeutic massage employs generalized manual techniques such as gliding, kneading, striking, shaking, and friction. Medical massage utilizes these same movements as soft tissue pre-treatment preparation for the deep tissue and joint treatment that follows this general soft tissue preparation. Medical massage deep tissue technique employs a relaxed hand technique referred to as the soft hand. This hand technique allows deep tissue penetration without patient discomfort and without making the patient's condition worse. Medical massage therapy utilizes patient positioning and soft tissue folding in order to reduce muscle tension and muscle contraction. Medical massage techniques combine joint movement techniques directed at all the joints and the soft tissue that is attached to the joints. These joint movement techniques are based on the normal physics of joint motion and include torque, shearing, accommodation, and traction. The techniques of Castle and Smith are also employed. The Castle techniques include shaking the arm or leg, and the Smith techniques involve the use of a bony lever and hand contact that move the joint and gently exercises and stimulates the ligaments of the joint. The homeosomatic system of medical massage therapy is a highly specialized system of soft tissue therapy that is based on theories and research regarding tissue healing. This system of therapy recognizes that the joint capsule and its attached soft tissue structures, especially ligaments, are the primary sites of pain and other problems. The medical massage therapist also uses exercise, heat and cold, and patient education in a treatment plan that helps patients recover from their problems. The introduction on medical massage presented in this audio CD must only be considered an outline of the subject. It is an insurmountable task to present in any form the profound character of massage, which is found to be more than the mere sum of its parts, and not simply technique, but rather a synthesis of education, training, experience, dedication, humility, and intuition, expressed through the miraculous instrument, the human hand. The medical massage therapist uses massage procedures in a specific treatment plan. The massage treatment plan is provided to the patient by the medical massage therapist for the purpose of 1. Preventing connective tissue degeneration. 2. Maintaining full normal range of motion in joints. 3. Reducing soft tissue inflammation. 4. Reducing patient pain. 5. Providing patient education and encouraging patient compliance with exercise and self-care instructions. And 6. Reducing stress to soft tissue and the body. A massage treatment is especially valuable to the individual suffering from long-term chronic degenerative conditions and is certainly a more viable and safe alternative mode of therapy than the long-term reliance on medications used by medical physicians. The only side effect of massage therapy is lower-cost care, effective treatment, and improved health. The physically active, sports-minded, or health-minded individual will derive ongoing benefit from massage therapy, including increased physical performance, flexibility, and injury reduction. Additionally, periodic massage therapy treatments will help to identify and correct problems that, left untreated or undiagnosed, would develop into more serious problems. One of the barriers to utilizing massage therapy has been the medical and insurance industries. Each of these industries, for their own reasons, has attempted to discourage massage therapy for maintenance or preventative purposes. These groups have not, however, discouraged the long-term and often dangerous use of medication, even when the medications have well-known negative side effects, are known to be less effective than massage therapy when used long-term, and are typically more expensive than massage therapy treatments. Fortunately for the public, good therapists like you are being trained and are helping to treat and to educate the public so that they can get safe and effective treatment. This ends part 1 of this 4-part audio CD program on the Homeosomatic Medical Massage Program of Dr. Gregory T. Lawton. We hope that you enjoyed this presentation. Perhaps you'd like to take a break and relax for a few moments before continuing on with part 2. I will wait right here for you. Welcome back. This is Sandra again, and we're about to begin part 2 of this 4-part presentation that covers aspects of beginning medical massage therapy and the homeosomatic system of care developed at the Blue Heron Academy over the last 30 years. In part 2, we will introduce you to ideas about what a medical massage therapist is, how you become one, and what you do once you are one. We will talk more about medical massage technique and patient treatment, and you will gain a broader appreciation for the differences between medical massage and other forms of massage. Well, let's get to it. You have entered an exciting and rewarding field, medical massage therapy. You have so much success ahead of you, and you are going to assist many people who need your skills and help. Medical massage is your vehicle to a new and rewarding direction in your life. So please, learn it well. There's a lot of good news in the massage industry. There's been a great deal of growth in the industry as indicated by an almost 10% increase in the number of individuals who report having received a massage since 1997. Almost 50% of physicians surveyed indicated that they would refer patients to a massage therapist, and massage is reported by consumers as being the #1 alternative or complementary healthcare practice that they use by 10 to 13% over other treatments and therapies. Newsweek reported in its December 2, 2002 issue that Americans make 600 million visits to non-conventional healers and spend $30 billion per year, most of that out of pocket. In 1993, Dr. David Eisenberg reported a Harvard Medical School study that indicated that 34% of the American population was seeing alternative therapists, and that number is now reported at over 50%. More good news has come in the form of the development of medical massage therapy at the Blue Heron Academy. Medical massage differs from other traditional forms of medical massage in that it directly attempts to treat a patient's condition. Medical massage draws upon the research that has been performed in biomechanics, sports medicine, physical therapy, chiropractic, and massage therapy, and bases its treatment on this research. The last 5 years have witnessed significant growth in medical massage education and the availability of training programs in medical or clinical approaches to massage. A new national association, the American Medical Massage Association, has been formed that strictly addresses the needs and requirements of medical massage therapists. Medical massage techniques, protocols, methods, terminology, theories, and science are based on standardized approaches to research, healthcare practices, and massage therapy. By aligning itself with the language and knowledge of medicine, medical massage is more easily understood and accepted by the medical community and the patient population that it seeks to serve. The medical massage therapist has a significant opportunity to provide a much-needed service to the American public that is seeking assistance with acute and chronic conditions. Currently, there is a soft tissue treatment vacuum, and there are not enough trained therapists qualified to treat patient conditions. The general massage therapist all too often has limited training and experience in treating patient conditions, and their toolbox of therapeutic, relaxation, fringe, cosmetic, spa, and franchise techniques is frequently inadequate for the specific treatment of patient problems. Medical massage is first and foremost massage therapy. Medical massage shares the traditional heritage of massage, but is discarding its non-scientific aspects. Medical massage is a system of natural health care and is therefore a non-invasive approach to patient care that seeks to support the body's own natural healing capacities. The power that created the body is the power that heals the body. This power is identifiable and understandable in scientific terms to the limits of our ability to observe it, but the limits of our understanding and knowledge about healing keeps advancing and evolving. Medical massage education, as with all healthcare training, begins with a detailed and thorough study of the structure and function of the human body. A significant advance in health education is a concept that is used in medical and chiropractic education called problem-based education. This educational process is centered on the idea that the best training focuses on the purpose of the training. In the case of massage therapy, the best training vehicle for learning anatomy, physiology, pathology, and technique is the actual practice on and treating of patients. Medical massage therapists need to be patient-focused and to understand their patients' problems and conditions. The medical massage therapist needs to be knowledgeable about the kinds of patient problems they will see on an hour-to-hour basis. At least 50 to 75% of medical massage training needs to be provided in a guided hands-on format, with a significant amount of that time spent in the supervised treatment of actual patients with real patient complaints. This contrasts sharply with the majority of massage programs that offer little or no patient contact. The students simply spend their hands-on time treating each other with a memorized massage sequence or routine. The medical massage therapist must also train in a medical, clinical, or chiropractic environment and gain as much experience as possible actually treating patients. Medical massage therapists must learn how to diagnose soft tissue conditions. This is shocking to many in the massage field. However, when any massage therapist palpates soft tissue and determines tissue tension levels, a shortened or weakened muscle, or locates a trigger point, that is diagnosis. Try not doing that in most massage practices. Medical massage therapists must also learn how to treat patient conditions. This is also shocking to many in the massage community. However, many medical massage therapists are qualified members of the medical community, nurses, physical and occupational therapists who are adding massage to their practice skills. They can legally treat patient conditions. In addition, massage therapists working under the supervision of an allopathic, osteopathic, or chiropractic physician can also treat patient conditions and pathology because they are working within the scope of practice of the licensed physician. The medical massage therapist should begin training to become knowledgeable about skeletal and soft tissue anatomy, the problems and disorders that occur in various body areas, and massage treatment techniques that are appropriate for the patient's condition. The medical massage therapist should begin by learning a body region such as the hand and wrist. Hand and wrist bony landmarks should be studied, then the muscles, followed by other soft tissue structures and how the area moves. After the anatomy and physiology of the region have been studied, the next step in medical massage training is to learn the basic problems that affect the hand and wrist. These conditions would include inflammation, arthritis, and sprain and strain of the soft tissues. Massage therapists who treat pain or chronic pain need to understand the correct procedures for the treatment of pain. These procedures include 1. Patient pain assessment, 2. Patient placement on the treatment table in a position that is most comfortable for the patient, 3. Surgical draping of the patient to expose only the area of treatment, 4. Positioning of the patient to place the area of treatment in a relaxed or neutral position, 5. Folding of the area of treatment to encourage further tissue relaxation and to allow deep tissue penetration with minimal pain, 6. The use of the soft hand technique as opposed to a stiff hard hand in order to allow comfortable tissue penetration, and 7. Look for a change or response in the tissue that indicates that the treatment has been successful. The type of hand technique mentioned here, the soft hand, allows the therapist to apply deep tissue technique without the adverse stimulation of pain to the nerves. The soft hand is strengthened from the inside of the hand. The hand is firm but relaxed, and the penetration into the soft tissue is deep, but it is not painful or invasive. Medical massage techniques and treatment protocols have been repeatedly mentioned during this presentation. What are these techniques and protocols? They include over 70 different massage treatment procedures, but they can be briefly described as including 1. Superficial or first and second layer soft tissue preparation. This is the warm-up stage of the treatment process. 2. Deep pocket deep tissue soft tissue treatment with a folding of the soft tissue so that it is in a relaxed position and is not contracted or stretched. 3. Deep tissue to the periosteum or bone, and remember, all deep tissue medical massage therapy is done with the soft hand and without pain. And 4. Joint movements that include twisting, gliding, jamming, stretching, pulling, and shaking of the joint and its tissues. The medical massage therapist needs to be focused on the patient's problem and recovery. Medical massage therapy is corrective and restorative, and the medical massage therapist needs to acquire clinical skills so that they are effective therapists. The medical massage training program takes the developing therapist and systematically teaches them how to treat acute and chronic patient conditions that they will see in the most common patient complaints. The medical massage therapy is not a casual or recreational massage therapist. They do not provide full-body massages. They do not use oil to lubricate the skin or to increase patient pleasure, and they do not provide salon or spa treatments. The medical massage therapist is trained in the use of various topical liniments, ointments, or medicated oils that are used as part of the treatment process. These substances are normally used at the completion of the treatment session for special therapeutic purposes. The medical massage therapist needs training in clinical treatment protocols and patient case management. This is the most difficult aspect of the training process because the beginning therapist does not have the experience needed to determine how many treatments are needed, how often treatment is needed, and how long the treatment process may take for a specific patient or problem. This knowledge is acquired over time and with clinical experience in treating various patient conditions. A good starting point for the beginning medical massage therapist is to use the 6-visit 3-week approach. Learn to break the patient treatment process into 3 weeks with 2 visits per week. Tell the patient that you will treat them twice per week for 3 weeks, followed by a reevaluation of their progress. This is not only a good treatment approach, but it is also a good patient management and retention procedure. A major factor in patient retention is patient education. When the patient has a timeline, knows the purpose of the treatment, and understands how much treatment will cost, they are more apt to comply with the treatment program. This patient management practice helps you to set incremental short-term treatment goals. The medical massage therapist should see patients on a 30-minute schedule. Most patient conditions do not require more time to treat than this. The medical massage therapist does not provide a full-body massage or a massage experience. The medical massage therapist, because they are treating patient conditions and treatment time is reduced for each client, can charge less per individual visit, therefore allowing more patient visits for the purpose of corrective and restorative care. The medical massage therapist can earn more per hour than a recreational therapist because they can treat multiple patients per hour. When the medical massage therapist is competing with therapeutic massage therapists for the same patient market, they can increase the patient's perceived value of therapy by using modalities such as heat, cold, or soft tissue laser to extend patient treatment time while treating another patient in another treatment room. This leads to the next level of medical massage training, therapeutic modalities. Therapeutic modalities are the use of clinical equipment or special procedures in the treatment of various patient conditions. Massage therapists have long employed methods which include heat, cold, vibratory or percussion devices, soft tissue lasers, electrotherapy, topical applications, liniments, compresses, or medicated oils, and other procedures. Therapeutic modalities are frequently applied in 15-minute increments. The use of these modalities imparts the following benefits. 1. Provides beneficial tissue responses. 2. Prolongs the patient visit and the perceived value of the treatment. 3. Allows the therapist to treat multiple patients per hour. 4. Reduces patient fees per visit. 5. Provides an affordable fee structure. 6. Broadens the therapist's scope of practice and effectiveness. 7. Diversifies the therapist's daily activities and reduces burnout. 8. Reduces ergonomic stress to the therapist. And 9. Increases patients that stay and follow the therapy program. The training of the medical massage therapist is based on standard medical terminology, record keeping, health sciences, and clinical approaches of patient care and management. The medical massage therapist is comfortable in medical and clinical environments and can speak the language of medicine. The medical massage treatment is, however, not a medical model, nor is it allopathic. Medical massage is touch therapy, and as such, its primary mechanisms of effect on the human body are holistic and natural. The medical massage therapist is capable of operating and maintaining a professional and competent clinical office environment, while at the same time providing all of the holistic benefits of massage therapy. Who says that professional capacity, clinical competency, and business mastery are incompatible with healing? The medical massage therapist is trained to work in a variety of healthcare settings, including private or group practice, holistic clinics, hospitals, medical and chiropractic clinics, rehabilitation and physical therapy centers, and adult care facilities. Because of the diverse practice opportunities available, the medical massage therapist needs to be trained in medical office operations, administration, and billing procedures. An individual who is trained in medical massage can work in any environment, especially medical, chiropractic, and clinical facilities. The massage therapist who is only trained in relaxation massage, on the other hand, is not trained or qualified for these clinical positions. Training should also include practice in administrative procedures that include the use of medical case or SOAP notes, medical diagnostic and procedure codes, and medical report writing. Training should also include record maintenance, confidentiality, and HIPAA requirements. Billing codes, medical terminology, and record keeping are simply a necessary part of doing business in healthcare. Whether a therapist chooses to bill insurance or not, if they treat any patient condition, a headache, or a sore hamstring, they are required by law to maintain written records. Medical massage students should be required to complete formal patient records and case files during their practicum and internship components of the training program. Additionally, in the event of a malpractice suit, the only proof against any allegations may be case notes and written patient records. In the absence of this written documentation, courts tend to accept and favor the testimony of the complaining patient. By learning how to effectively manage your patients and keep accurate records, you are assuring your success and the long and continued enjoyment of your practice in one of the most rewarding professions there is, the healing profession. Let's take another break and get ready to listen to part 3 of this presentation on medical massage therapy. I hope that you've enjoyed what you have learned so far and that you are ready for more. This is Sandra Bovey again. Are you ready to continue your investigation of medical massage therapy? Let's begin. The massage profession is represented by a rich diversity of massage technique that is the product of the ideas, concepts, and theories of massage practitioners over many centuries. After years of practicing in the shadows of healthcare, massage therapy and other forms of traditional healthcare, such as acupuncture and herbal medicine, are gaining wide and enthusiastic acceptance within the public and professional arena. The massage profession is composed of many different systems of therapy and practice. Some massage systems are strictly esoteric, and others label themselves as therapeutic, sports, orthopedic, clinical, or medical. Massage will always be valued and appreciated for its nurturing and comforting effects on the human body, mind, and spirit. It is in the area of clinical claims for effectiveness in the treatment of human disease that massage will have to prove its claims of safety and effectiveness and pay its dues in order to gain the respect of the public and the other healthcare professions. One of the stepping stones to this respect and acceptance is research. In part 3 of this 4-part presentation, we will look at how research can have a direct effect on the massage techniques that we use in the office and on our patients. Many massage therapists would be surprised to find out that a great deal of research on massage therapy and its effects in areas that directly relate to the practice of massage has already been completed and is easily available for review. There is indeed a vast body of this research already in existence. Research has been performed on specific massage techniques and their effectiveness, and research has been performed that strongly relates to the practice of massage. This includes research in the fields of chiropractic, manual medicine, biomechanics, physical therapy, occupational therapy, osteopathy, and psychology. Research on medical massage is now available in many professional journals, on the internet, and in books like Dr. Lawton's. Very little of this research has found its way into the general massage community. Much of the research that has been presented to the massage community is often outdated or, unfortunately, it has been misinterpreted. It is true that more research needs to be performed and that this research needs to be directed at the specific techniques and methods used by well-trained, advanced massage therapists. Research that has been performed in the U.S. has been particularly poor. Techniques that are studied are often not performed by a trained massage therapist, or the techniques that are used are too general and nonspecific. This situation is, however, not true of the worldwide research community, and excellent studies have been performed in Europe and especially in the Scandinavian countries. By the way, how's your Swedish? Why do we need research? Well, maybe you don't. In Sweden, for example, research needs to be performed on any technique that will be used to treat human disease, and then it will be covered by their national healthcare system. Incidentally, the Swedish government will pay for the research, and if the result is positive, they will pay for the massage treatment. If you don't practice medical, orthopedic, or sports massage, but rather practice from a non-clinical approach, then you probably don't see what all the fuss is about. Most countries that have a long tradition of providing access to massage therapy as a treatment for human disease have established a basic ethical standard of care. That standard is based on research and proof of effectiveness. Within the many kinds of massage, there are two distinct divisions into which basic massage techniques can be broken down. 1. Direct physical effects of massage therapy, and 2. Indirect effects of massage therapy. Massage has a long history of evidence that supports its claims to achieving direct physical effects on the body. Any practicing massage therapist can easily tell you about the effectiveness of massage therapy for a wide array of physical conditions and disorders. Ongoing research and study will assist the practicing massage therapist in understanding which techniques are the most effective in the treatment of specific patient conditions. Research will help us write better massage textbooks and train better massage therapists for the future. Recent research and study that has specifically investigated common massage techniques, such as compression, stroking, kneading, and percussion, has demonstrated the following. Massage therapy is important in the movement of fluid and tissue, including the lymph system. Muscle compression acts as a fluid pump that improves circulation and drainage in and out of tissue and assists in cellular metabolism. Muscle compression and light tapping over the muscle or tendon relaxes muscle tissue. Massage technique that includes muscle stretching promotes tissue growth. Compression of tissue reduces tissue edema. Reduction of edema and the reestablishment of normal range of motion in joints and extremities promotes tissue healing. Passive or active movements of joints stimulates the fluid in joints and cartilage formation. Joint massage strengthens joints and makes them more flexible. Stimulation of tissue mechanoreceptors decreases pain. Tissue mechanoreceptors are stimulated by light to deep tissue pressure without causing pain and gentle repetitive movement of the tissues and joint. The direct effects of massage establishes massage therapy as bringing about many beneficial effects on pain control and the promotion of tissue healing after injury. If this was all we knew about the beneficial effects of massage, it would be enough. But there is more. Massage therapy used in medical, orthopedic, and sports therapy aspires to a higher research standard than what is commonly found in the general massage field. Over the last 50 years of massage history, massage therapists, manual therapists, osteopaths, and chiropractors have formed a large number of theories regarding how the body works, and particularly how it responds to massage and movement. As in any field, some of these ideas are valid and some are invalid. Some have been researched, but many have not, at least not in any generally accepted sense. Some of these ideas have been disproved. A large number of these invalid ideas are a common component of current massage education and practice in massage schools across the country. Studies are a common and readily available part of the scientific research of many of the other healthcare professions like physical therapy, and this information relates to massage therapy as well. The Scandinavian massage therapists have used this information to guide the use of appropriate massage technique. It probably would not be incorrect to suggest that well over 90% of the massage therapists currently in training, and we train about 47,000 massage therapists per year, are still being taught the incorrect models of body function in therapy. This training has in effect become massage dogma. Unfortunately, many massage therapists now have to unlearn much of what they have come to accept as being true about the relationship of body physiology and neurology as applied to massage technique. If you are beginning your massage training and using this audio CD as a guide, you will not have to do that. Most general massage techniques that involve gliding or compression have been shown to be effective in the general treatment of conditions of muscle spasm and pain. These techniques that are gentle and do not cause pain are especially effective in the treatment of abnormal neurological conditions that have resulted from injury or damage to the nervous system, such as a stroke. Techniques that involve gentle, passive, repeated joint movement and light stroking, compression, or percussion reduce abnormal tightness in muscle and assist the patient in acquiring new skills in muscle relaxation. The massage therapist who is using any deep tissue massage technique on a post-stroke patient for the purposes of breaking down muscle contraction and relaxing spastic muscle is doing more harm than good. The deep tissue technique overstimulates tissue and increases pain. This results in hypersensitivity and increased spasticity in the affected body region. Subjecting the patient to exercises that involve active contraction against the therapist's resistance only increases muscle contraction and damage. The correct methods of therapy for patients with abnormal CNS conditions involve slow, gentle, repetitive, passive movement of the joints, slow, gentle, low-force, passive stretching of the agonist muscle, light, gentle, low-force compression, stroking, or tapping of a muscle, and therapist-assisted muscle relaxation training. Another issue that many massage therapists are confused about is the definition of muscle tone and motor tone. Most massage textbooks and schools teach that there is a resting muscle tone or that abnormal muscle tone results from nerve activity or stimulation. This is not correct. Muscle tone is simply muscle bulk and nothing more. Muscle tone is fluid in the muscle and the soft tissue that composes the muscle. It is like holding a raw chicken breast in your hand. When the muscle is placed in a completely relaxed position and the therapist palpates the muscle, they are palpating muscle bulk. The tension or resistance in the relaxed muscle can change with fibrous tissue invasion of the muscle, and this condition is called fibrosis. Or the tissue can swell with increased fluid buildup, say after exercise, or during inflammation due to injury of the muscle, like in the swelling seen in a sprained ankle. Motor tone is a result of nerve stimulation to the muscle. Motor tone varies, increases or decreases in direct relationship to nerve activity, either normal or abnormal. A resting or relaxed muscle is neurologically silent, and there is no resting motor tone in normal circumstances in a healthy nervous system. Many massage therapists fail to place a muscle in a completely relaxed, neutral, or folded position, and they often attempt to evaluate muscle tone in a contracted or in a stretched contracted state. Contracted muscle is neurologically active and does have motor tone. An example of this is a patient placed face down on the massage table with their arms hanging over the sides of the table. The therapist then feels the stretched contracted back and shoulder muscles. The therapist is actually feeling active motor tone, not resting muscle tone. They are palpating active muscle contraction and not muscle bulk and fluid accumulation. This improperly applied procedure of course results in incorrect information regarding muscle tightness and shortness and will most likely lead to improper and unnecessary treatment. Additionally, it is very difficult to treat and relax a muscle while it is in the state of active contraction due to improper positioning on the table. The facts, ideas, and concepts in this presentation are presented for the purpose of assisting the practicing massage therapist in understanding the science behind the art of massage. Many massage therapists need to update their training and practice skills to include new understandings about how the body functions and how massage technique might more effectively assist the therapist in their role of patient treatment. Knowledge and the ongoing search for it is a process and not an event. Just as some massage theories and techniques are now known to be outdated or ineffective, new findings have presented new methods and techniques, and undoubtedly this process of change and discovery will continue. In the end, this knowledge can only make you a much better and more effective therapist, more successful in practice, and more effective in helping your patients along the road to recovery. Rather than being distressed or frightened by this vital process of growth, the massage therapist should welcome it and the benefits that it will bring to their practice of massage and their ability to more effectively serve the healthcare needs of their patients. Welcome to Part 4 and the final segment of this audio CD presentation on medical massage therapy at the Blue Heron Academy of Healing Arts and Sciences. There are many different kinds of massage therapy and massage therapy techniques. This part of this audio CD helps you to understand two systems of massage therapy, therapeutic massage and the homeosomatic system of medical massage. The homeosomatic system of medical massage is composed of a strictly defined clinical protocol, and therapeutic massage is not. Therapeutic massage is most often practiced as recreational or relaxation massage. Massage therapy techniques can have two types of body effects: generalized effects and specific effects. All methods of massage therapy have generalized body effects, whether the massage therapy is used for clinical or relaxation purposes. It is in the area of specific clinical effects that systems of massage separate into two different categories, medical and non-medical. Homeosomatic medical massage claims that it is a specific system of clinical therapy that promotes connective healing in patients. Therapeutic massage may be broken down into two categories of techniques. Those techniques originally developed by Per Henrik Ling and represented by the Swedish massage system, and extra techniques added to the Ling system and utilized by therapeutic massage practitioners. Examples of this latter category of technique would include trigger point therapy, skin rolling, PNF, and muscle energy technique. To make the whole thing even more confusing, some practitioners of medical massage utilize therapeutic massage, Swedish massage, and simply label it medical massage because they do not practice therapeutic massage for relaxation massage purposes, but rather clinically. Some practitioners of therapeutic massage consider themselves to be medical massage therapists if they use therapeutic massage in a clinical or medical environment, if they add muscle testing and range of motion techniques such as those used in physical therapy, or if they simply add medical billing to their relaxation massage techniques. Homeosomatic medical massage therapy says that any system of massage therapy that claims a medical effect must demonstrate that its techniques stimulate the nervous system, reduce pain and inflammation, and restore normal joint range of motion. This is Sandra Bovey saying, let's talk about medical massage therapy. What in the world is a proprioceptor? Well, actually no one knows because they do not actually exist. Within the general massage culture, the term proprioceptor is used to describe a type of sensor that transmits signals related to a sense of position of a body part, like how you know where your finger is if you touch your nose with it. Various massage techniques have been developed by different massage therapists and osteopaths that claim to reprogram or normalize proprioceptor function. In medicine, the term proprioceptor is and has been recognized as an inaccurate and non-scientific term and has not been accepted since 1926. Scientific literature related to the use of the word proprioceptor dismisses the term for the following reasons. 1. A misleading, arbitrary, non-scientific term. 2. The term proprioceptor does not describe a real body part. And 3. The ideas about how proprioceptors control body function are incorrect. Most, if not all, massage textbooks refer to and teach treatment and technique based on the concept of the proprioceptor. Several methods of massage technique are based on the inaccurate concept of a proprioceptor. If the term proprioceptor is not a real medical term, then what terms are correct? Mechanoreceptors and nociceptors are sensors that provide information to the body about pleasure and pain. The nociceptors tell the brain about pain, and mechanoreceptors report things like heat, cold, and touch. Each of these two types of biological sensors tends to block the other. Nociceptors are found in the skin and throughout muscles and joints. Nociceptors have been found to be distributed almost everywhere. Nociceptors have dramatic effects on the nervous system and may cause dizziness, weakness, a cold sweat, and nausea when there is pain. Mechanoreceptors respond to normal tissue conditions and report this activity to the brain. Mechanoreceptors appear to respond to weak signals, gentle movement and pressure, and normal range of motion of the joints. Mechanoreceptors do not respond to things that injure tissue and are in fact blocked by pain. This information regarding nociceptors and mechanoreceptors is vitally important to an understanding of what constitutes effective medical massage therapy. Rather than basing our understanding and application of massage therapy simply on inaccurate ideas of body function, we should seek to understand the scientific knowledge that reveals the deeper secrets of physiological function as it pertains to connective tissue therapy. Based on what is scientifically known about mechanoreceptors and nociceptors, we can suggest the following principles as applied to medical massage therapy. 1. Mechanoreceptors respond to normal soft tissue conditions. 2. Nociceptors respond to conditions that cause pain. 3. Mechanoreceptors and nociceptors are very widely spread throughout the body tissues. 4. Almost all tissues contain mechanoreceptors and nociceptors. 5. Mechanoreceptor stimulation will block nociceptor stimulation. 6. Nociceptor stimulation will block mechanoreceptor stimulation. 7. Almost all conditions treated by the medical massage therapist involve nociceptive symptoms. And 8. Almost all conditions treated by the medical massage therapist can be improved through mechanoreceptor stimulation. The above 8 principles provide the medical massage therapist with an outline for providing medical massage therapy. The medical massage therapist can treat the body according to how it really works and not based on fabricated ideas. The following 4 aspects of effective treatment can be identified from the 8 principles just mentioned. 1. Massage therapy technique should stimulate mechanoreceptors through gentle pressure and joint movement. 2. Massage therapy technique should be directed at all soft tissue structures known to have mechanoreceptors, from the surface to deep structures, but this technique must stimulate mechanoreceptors and not pain. 3. Massage therapy technique should include gentle joint movement designed to stimulate mechanoreceptors in all soft tissues and the joint. And 4. Positive results will continue long after the massage therapy treatment due to the normalization of soft tissue, which will increase mechanoreceptor activity and block pain. Therapeutic massage techniques or any system of massage therapy that causes pain will retard and delay the healing of injured tissues. Techniques that are improperly applied, such as trigger point therapy or deep tissue techniques, will stimulate pain and increase muscle spasm and adverse effects such as dizziness, weakness, cold sweat, and nausea. From the previous discussion, it should now be clear that the proper application of medical massage technique should include the avoidance of technique that stimulates pain. This stimulation has an adverse effect on the outcome of the treatment and the patient's healing process. From this viewpoint, pain is not gain. The massage therapist who wishes to apply the principles presented here in their clinical application of massage therapy technique probably needs to make subtle changes in their manual technique. These changes include: 1. Deep tissue techniques should be applied with a soft hand technique. 2. Deep tissue techniques should be applied first with a gentle pressure into the tissue for a depth of 1 to 3 centimeters to stimulate the mechanoreceptors, and then into the deeper tissues. 3. Joint movement techniques should be applied with supportive manual pressure on the joint and then with gentle normal range of motion. And 4. All reachable soft tissue at the joint should be systematically massaged and then gently moved. The homeosomatic approach to medical massage therapy is a scientifically based method of therapy. Medical massage seeks a clear understanding of the workings of the body that affects soft tissue healing and treatment. Many popular therapeutic massage techniques unnecessarily cause patient pain and make the patient's condition worse due to a distorted idea about proprioceptors and trigger points. This information is important to all massage therapists in order to clarify this issue and to offer more effective treatment methods. The next time you see a massage instructor demonstrating trigger point therapy with their elbow buried an inch into the patient's back, consider the pain that this technique is causing the patient and ask them to stop. Then, give them your copy of this CD. Thank you for listening to this audio CD program entitled The Fundamentals of Medical Massage Therapy, Medical Massage for Beginners. This is Sandra Bovee, and I hope that you've enjoyed this presentation. For more information regarding the Blue Heron Academy of Healing Arts and Sciences, the home of homeosomatic medical massage therapy, or for other educational materials or seminars on medical massage therapy, please contact the Blue Heron Academy of Healing Arts and Sciences, 888-285-9989, or visit the Academy online at their website, www.blueheronacademy.com.